Later, ladies and gentlemen, welcome back to my YouTube video channel, the channel for uh, dentists, dental hygienists, dental assistant, whoever get involved with the profession of dentistry. Today, I have a topic, again, continue with the series of orthodontics for beginner, as well as for those who are interested in learning about braces. Let's jump into the screen so we can share the screen and start with the presentation today. Today will be how to manage the minor crowding case. Tip for beginner. A lot of time when you see a case that is considered, let me just share this slide again. I'm sorry about this. All right. Managing minor crowding case, tip for beginner. Hi, my name is Dr. Win. Welcome back to my YouTube video channel. Before we start, if you see this is helpful, continue watching it. Please don't forget to subscribe to this channel so that way we can continue communicate and share the different technology, technique, and news about dentistry, and as well as other things in this channel. I'm sure you will find it interesting. Let's jump in this case right here. You look at this case, if the patient doesn't have any concern, you would say that she have nice smile, she doesn't need any treatment, right? If you agree on that, make some comment. If you look deep into her case situation, her bottom teeth have super erupted on number 23 to 26. It's higher than the canine. So that's called super erupted. What does that mean? It means that she would have a deeper bite. As you can see, she have a deep bite. And also there's rotation of severe rotation on number 23 and lingually inclined, distally inclined on number 26. Number 7 and number 10 seem to be a little bit awkward. It doesn't seem to be straight down, but it's a little bit tilted to the distal, and the root is easily tilted. Now, it's not too bad, isn't it? You know, this case is like almost perfect, but you can look at this way. Look at this. Look at the angle of the lingually inclination and super erupted of the lower incisor causing a deep bite. And what does that mean? It means that the patient had she's really young. She was only 16 years old. She already had wear and tear of the lower incisor here. If I can do another video, another picture, you can see starting to have very sharp edge of the enamel here. That's because of the wear and tear. Being a dentist, if you're not able to identify these early condition of the patient, you will lose a chance to correct the bite for the patient. Okay, you lose the chance to correct and reduce the risk of wear and tear and grinding problem for the patient. This is the reason why at the dentist, you see patient all the time. You need to take some time, evaluate the bite, evaluate the enamel. You see enamel wear and tear, there is a problem of the teeth. Look at the occlusal view, guys. You can see that the shape of the art is not really it's a U shape. This two, number 4 lingually inclined compared to number 5, and as you can see, 7 and 10 seem to be distally rotate, distal and facially rotate right there, and that put you into a situation where you can help the patient turn the tooth to align with the occlusal line angle. All of these have to be in the one art. So we'll see what we can do. Lower bottom teeth, same thing. You can see that number 24 and 25 are lingually inclined and superly erupted. And these two, number 23 and are distally rotate. This is distally rotate on the distal part, facially on the distal part, and lingually rotate on the mesial part. Overall, and also the premolar right here, There's rotation right there. You can see rotation measly of the buccal cusp. Detail is very important when you evaluate the patient, the bite, the problem. You have to see what are the rotation. Minor rotation can cause crowding teeth and grinding teeth. So you identify, improve the patient. That's a job of a dentist. So the more you see patient, take your time, evaluate the situation. Look at this one. You know, pretty nice. You know, if you just clean your patient teeth, let them go home, no problem. But I just show you the problem. When the people smile like that, seem like there's no problem, right? But when you look at the situation, you see the problem that we could improve. Enamel wearing on the bottom teeth and canine wear and tear slowly but surely where there is problem. So what we do, we put braces on and straight these bottom teeth out, and you can see the improvement. This is not the, so this be before, etch and bond, put brackets on. You can see the smile very more prominent, more uh, um, um, aesthetically improved right away. Um, so once you put bracket on, you can see how uh, the unalign of the teeth, the occlusion, and that's where you see the minor case cannot be seen unless you put brackets on and you see that. How do you do that? You go through the ortho training program. They will teach you how to place the brackets, and once you put the correct level of brackets, you will see the the discrepancy of the of the occlusion, and that's how you can identify the problem. I just want to draw some line. You can see that the uneven, the rotation of the root of these tube here. Obviously, if I don't put those line, you won't see the difference. The tube can be, you can see how it's changing and improving right away. The distal from the distance from here to here, it's really big, but now it's closed. And you can see this, the degree of rotation of this tube number 23 was really rotate, but now it's straight. So it's improved right away. Continued treatment, you can see that the bottom tip is now aligned really nicely. That, and it's also upright too. The root of the incisor are upright. It same thing on the central and lateral incisor. There's a slow improvement there. So again, the teeth were off, but look at it now, all those incisor edge are in one line. Before that, they're not. They are up in the air right there. Number 7 and number 10 ways up there. Look at that rotation. The more we put braces, the more you see. You put vertical elastic to improve the maximum intercuspation of the teeth. So overall, I just don't want to spend too much time boring you, but I want you to see the difference between before and after. Look at that. Look at how much the improvement of the teeth now. You can see how the expression of the root tort completely expressed. Everything looks straight, and the patient smile with a lot more confident smile. So here, checking this out, you can see that from this after treatment, I will show you the before and after, but you can see that the patient now can smile with fully expression of bottom and top teeth together. Bottom teeth are straight now, and rotation of the all those incisors being corrected. Okay, so here is the before and this is after. You see how much expression that the patient show. Total smile is have been expressed. So it's beautiful when you put bracket on and you correct it. So this is be minor before and this is after. I didn't have a good model to show you, but it's, look at the occlusion, straight, everything straight out now. Before and after. there's a great improvement in terms of the expression of the confidence of the smile versus the sort of like shy when she smile right there before, but this is after. So this is before and this is after. Before and this is after. Before and after. Look at the, I would say that most important thing for us is correcting the occlusion of the patient to prevent the patient from further damaging their enamel in long term. She was only 16 years old. So look at how much improvement. This is the before and this is after, how straight it is. Again, before and after. You can see how the total expression of the teeth from lateral incisor, the root is straight now, and the bottom tooth root toward are straight, no rotation. This is before, this is after. Patient were very, very happy to see her total confidence smile. She loved her smile, and now she's she was when she finished, she's turned into like 17, graduate from high school, got a job, very happy. And would like to thank you everyone watching. And if you have any question, comment, feel free to ask me below and subscribe to my channel. Most important thing, guys, to summarize this case, it is something that most beginner will be neglect because you don't see it unless you take picture and evaluate the enamel of the patient in detail, guys. Very tricky. This is not an easy case. One of the tip I want to give you guys is when it's a minor crowding case, it's actually harder than a really moderate or severe crowded case because you cannot really compare unless you take picture. So it's challenge. It's require you to document your case well, and it's require you to be a little bit more, spend a little bit more time on this case than the typical moderate to severe case. Thank you for watching. Before you hang up, don't forget to subscribe. Have a wonderful day. Take care, you guys, everyone.